Can you please tell us about the importance of the problem of nocturia?
First of all, nocturia is still an underscored problem because following the definition, nocturia also fits in the diagnosis of overactive bladder. So for many colleagues it still is considered as an element of the overactive bladder syndrome or of the global syndrome of lower urinary tract symptoms. However, it's important to realize that nocturia is a specific symptom that in the majority of patients is related to other mechanisms than overactive bladder. So it's only a minority of the patients where nocturia is related to overactive bladder. For the majority of patients it's related to nocturnal polyuria, which means an overproduction of urine during the night. Normally we have a mechanism that reduces urine production during the night, and this mechanism can be disturbed and leads to overproduction of urine during the night. On specific question on how frequent we see this problem, we see two things. First of all, there is increasing incidence with aging, because the mechanisms that protect us to produce urine during the night also suffer from aging. So there is an increased incidence with aging. That's one thing. However, we have to realize that also in a certain proportion of younger people, this can be prevalent. The second thing is that the prevalence is equal in males and in females. Before one was thinking, okay, it's the prostate, but we know now from epidemiological studies that indeed it is also prevalent in women. Now there is a difference, of course, in terms of the impact on quality of life and also morbidity depending on the number of nocturnal voids, the number of nocturia episodes. It's also known from studies that as soon as the level reaches 2 nocturia episodes, the impact is much more important. On the other hand, there are some patients that have not so good sleep, and so when they have only 1 nocturia episodes and the sleep is disturbed and they have difficulties in getting to sleep again, they will have an impact on their quality of life and eventually can create morbidity. So that's also an important element that we know now, that nocturia beside quality of life will have an impact on morbidity. It will increase cardiovascular problems, and some studies indicate that it even can increase mortality independent from other factors, so as the sole element producing a higher mortality. There is also one trivial thing, for example, waking up at night and going to the bathroom in elderly people is one of the most important reasons for hip fractures. Because the people wake up at night, they're still a little bit dizzy from waking up, they try to go to the bathroom and they fall and break their hip.
What is the level of knowledge of this serious, as you said, problem among doctors, I mean general practitioners, family doctors?
As I said before, it is still underscored because many physicians still consider that nocturia is part of the normal aging process. So there is a tendency to say, well, you know, your parents had it and elderly people have this, so you have to live with it. We do not agree with that statement because even if we know that the prevalence is increasing with aging, still, as I said before, it can create morbidity, it can increase mortality, and definitely will have a major impact on the quality of life. So we have to fight this idea that this belongs to normal aging process. So that's an important element. Why this resistance of physicians to attack or approach this problem? Because it is kind of complex. Physicians like to think in monodisciplinary aspects. Now with nocturia there are several aspects related to it. Of course there is the abnormal urine production, but this can be related to an abnormal mechanism creating more important urine production during the night, but it also can be related to small bladder capacity, or it can be related to global urine production that is too important, which can be linked to drinking behavior. So that's important. Also, we have to realize that nocturnal polyuria, the overproduction of urine, can be related to an intrinsic problem related to antidiuretic hormone. Antidiuretic hormone is a hormone that is produced during the night to reduce urine production. This can be reduced with aging, and also the kidneys can be more resistant to this antidiuretic hormone, hence producing nocturnal polyuria. Beside that specific reason, there also can be reasons for general health that are responsible for nocturnal polyuria. That is, for example, peripheral edema due to cardiovascular problems. Also, venous insufficiency can create peripheral edema during the day, and then at night when the individual is laying down there is this venous return and overproduction of urine as a consequence of that. So that makes that for the average urologist there are some internal medicine aspects. For the GP there are so many general aspects included. So it is from an intellectual point of view and also a medical point of view a more complex problem, and so is a little bit reluctant to attack the problem.
What are the solutions to this complex problem? In other words, how can we treat nocturia?
Well, that's an important question, of course, but as a consequence of what I said before, since the pathophysiology is so multifactorial, the first thing is to make a proper diagnosis and to see what is the specific cause or what are the causes of nocturnal waking up to go to the bathroom. First cause can be nocturnal polyuria. As I said before, this can be linked to the fact that there is peripheral edema, that there are cardiovascular problems, or even a more trivial reason, which can be too excessive drinking in the evening. A typical example is somebody watching television, drinking a lot of beer. Of course, that can create also nocturnal polyuria, which is not then a pathological phenomenon, but still it is a point that can be attacked. If there are no such specific causes for nocturnal polyuria and the overproduction of urine is linked to the reduction of antidiuretic hormone or the need for a higher amount of antidiuretic hormone, this can be treated with a medication that is called desmopressin. And desmopressin is a synthetic analog of the natural antidiuretic hormone and can be given as a specific tablet in the evening, and then it reduces the urine production during the night. And that's an interesting modality. Before, people were reluctant to use this medication because at a certain dosage it can create hyponatremia, a reduction of serum sodium during the night, and this is a risky side effect. But recently has been brought on the market a lower dosage of desmopressin and also a gender specific, because females are more sensitive to desmopressin than males, and hence there is a dosage of 25 micrograms for the females and 50 micrograms for the male population. So that's the problem of nocturnal polyuria. If there is global polyuria, then again it can be drinking behavior that should be corrected. Some people are drinking excessive amounts of fluid during the day, and of course they can create a huge amount of urine production. There is also a specific condition which is called diabetes insipidus, which is a global lack of production of antidiuretic hormone, and so this can be diagnosed because these are people that have huge amounts of urine production on a 24-hour basis, and these are people that should be referred to internal medicine doctor. Important to state is that the diagnosis of the different causes of nocturnal polyuria or of nocturia can be made with voiding chart. If one asks the patient to fill out the time of voiding during the day and during the night, measure the amount of urine that is voided, one can calculate the total urine production on a 24-hour basis, and one also can calculate the nocturnal urine production. Based on that, one can calculate which is the percentage of nocturnal urine production. If that is above 1/3, then we speak about nocturnal polyuria. If on a 24-hour basis, the total urine production is more than 40 milliliters per kilogram body weight, then we know that there is global polyuria. So that can be diagnosed on the voiding chart. Also on the voiding chart we can see the bladder capacity. If the bladder capacity is very low, which can be an indication of the overactive bladder syndrome, then we know that there is a specific urological problem that can be tackled with other medication to treat the overactive bladder. As such, we can have specific diagnosis and then a specific treatment oriented to these problems.